Hi, folks. This is Matt Duval. I'm currently a candidate for the 102nd Legislative District here in the state of Pennsylvania. I just wanted to give a little intro to these videos I'm going to be doing. Basically, what they are is just conversations with people around different topics of interest. My attempt to gather some different perspectives. So I wanted to say that obviously the opinions expressed in these interviews are only those of the people talking. Um, but in general, I enjoy hearing the perspectives and often learn things I did not know. Along with that, I wanted to encourage you to express your own opinion. I would also encourage you to keep the discourse civil, but I am aware of how social media works. I know that that's not always going to be the case. If anything gets too personal or offensive, I may take it down. Um, if you want to express an opinion contrary to those here and don't feel like you're being heard, reach out to me on duval4pa.com. Send in the contact form. Let me know what topic you'd like to talk about, and I will host one of these video chats with you, and as well as other people who may be interested in the same topic that you are. And all of those questions I provide to these folks ahead of time so that they understand what the conversation is going to be about. And you always have the ability to say you don't want to participate anymore at any point in time. So I hope you enjoy these videos. We're calling them Midday with Matt, which is kind of a take on like Late Night with David Letterman. Even though I am not filming these midday, maybe I will be posting them midday, or you can watch them midday. All right, everybody, enjoy and stay safe. All right, so here with Dr. Mark Foley and Stacy Foley, and I guess if you guys want to give a brief introduction um, about who you are, what you do.
Okay. Yeah, we run the Wellness Point, which has been, we've been around since 2007. So we've been open for quite a while and always in the Anvil area. We do primarily acupuncture, some osteopathic manipulation. We do counseling in our office, educational programs, and that's what we've been doing since we opened.
Yep, I'm Stacy Foley. I'm a mental health counselor and educator. I do that sort of side of things at the Wellness Point. And I'm sure we'll get into it more later, but we had some pretty big plans before the pandemic
Right.
hit. So.
Yeah. Yeah, so I guess, that's obviously one of the things on people's minds these days.
Yeah.
So I was wondering how that has impacted you professionally.
Okay. Prior to Governor Wolf's stay-at-home orders, we decided that to be safe and responsible, we would actually close our business temporarily. Most of what we do is in person and actually gets quite close with acupuncture and things. You just can't keep your distance very easily. And we thought that the responsible thing to do would be to close, which obviously has hurt our revenue. And besides us not being able to do most of our work that we normally do, we have a counselor in our office that had to stop seeing patients, a yoga instructor who had very big classes, very popular classes that had to stop doing those in person. They both moved everything virtually. So besides our services being quite limited, others that were providing very valuable services no longer could do that as well. Right. So it's been a challenge. So the one thing I've been able to do, which is even at a limited basis, is I can still do my medical marijuana certifications for new patients and existing patients, but it's a lot smaller amount of business than it was before the pandemic hit. So we're feeling it.
I'm sure.
Yeah, we're still closed, and we'll stay closed until it's safe enough to reopen. We're trying to do what we can virtually. I've offered some quite a few live sessions not sessions, but like live Facebook live casts, I guess, through our Facebook page, especially early on during all this, just checking in on people, checking in on their mental health, giving them a space to talk about how they were feeling and how they were handling this, and to offer hopefully tips to help people help people through it. We're trying to figure out what we can do. Obviously, acupuncture you can't do virtually,
Right.
but mental health has some possibilities, and so we're trying to see what more we can. We've done some things. We'd like to expand and do more because we don't know how long this is going to last.
Right. And I know, like if somebody's working and then they were off of work, now they can file for unemployment. But as the business owners, what is there any kind of like government programs or loans or grants that you have been able to take advantage of or know of?
Yeah, we were able to, as self-employed individuals, apply for the Paycheck Protection Program.
Okay.
We got a very small amount of money, which does help cover some of the expenses that we have. Obviously, we're still renting a space and still have utilities to maintain and such. And so a lot of that is going there. And that's the big program we're able to tap into as far as business owners.
Right.
Yeah, which has been helpful, to keep things going while we're not able to see patients.
Right. Yeah. Do you think there's more that could be done there?
Mm-hmm.
As far as helping businesses, I think so, especially small businesses. I mean, most of the small businesses are not in need of a great amount of revenue to sort of tide them over. And we're seeing large portions of recovery funds going to bigger businesses that could weather the storm a little better in theory. And so we've actually talked to a lot of small business owners in our own circle who they're frustrated and they wish they could get back to work because they are losing revenue. And we're fortunate. I do work at one of the hospitals in the area, so I work there most mornings. So that is still there. I consider myself very lucky that I still have that revenue stream. But most small business owners don't have that. They have so many services they cannot provide without opening the doors. And I think a lot of them could use more help in the meantime.
And my philosophy is I'm personally okay with not in a situation like this, a global pandemic, this unprecedented event in our lifetime, something of this magnitude. We've seen economic hardships hit our country before, and there have been, after the Great Depression, FDR had the New Deal, and we've had, real estate and bank bailouts when there have been recessions. I don't think it's out of the realm of possibility that we should be considering bailing out people, like the working middle class, Main Street, those of us that keep things going. I don't think there's any shame in that. I think that's part of being a society, and it's for a time. It's to help us out now. So I think we should be doing that. I think it's the humane thing to do so that people can stay solvent but also safe. I don't feel like people should have to choose between those two things.
Right. And I think some of the bigger businesses, national, international businesses that are able to sort of fill the gap right now, I think we're going to see a problem when all the small businesses come back out because they're starting to take a bigger market share, and people are getting used to using larger virtual businesses, and some of the smaller businesses, they already struggle. They're already seeing effects of these big corporations, and so I worry that when we're actually able to open our businesses, that people who do provide similar services might have a hard time reclaiming that market share.
Right. Yeah, I mean, that's one of the things I think about is something Stacy said, which is that we're often presented with this almost binary choice, like we either reopen or we let businesses fail, as if there's no area in the middle. And then the other point is, just because you say businesses can reopen doesn't guarantee that they have business anymore.
Right.
It goes to how that happens and how you make people feel safe to go back, and also make it possible or attractive in some way for them to go back. So yeah. And then just generally, I guess along those same lines, like what kinds of things do you think individuals can be doing right now or should be doing to contribute to keeping everybody safe, basically?
Well, as coming at this from the perspective of medical areas, and like I said, I still have direct patient interaction. There's still a concern about our patients developing COVID, bringing it from the community, exposing our other patients, our staff, even staff bringing it in. But there's a real risk. It's a non-zero risk that we experience every day. And I bring that home with me every day too, where I do have concern being sort of, I'm on the front lines to a point. Our facility is not quite as busy, but we still have a real risk there. And so I think the first thing that people can keep in mind is before even considering how to keep people safe is to recognize that there is a danger. This is a big problem. Even if the numbers don't seem that way to some people, it's a big problem. And I think one of the things we can do is kind of pay attention to those who have expertise, who have the knowledge and the background to make the decisions, make recommendations as things change, because it's a novel coronavirus, meaning it's new. It's something we've never seen before, and for how we haven't seen it that long, we're making good progress, but there's still things to learn, and our best medical judgment sometimes changes through time. And so be patient, understand that those people who have expertise are doing the best they can to share that. I think that staying home as much as possible is really an important thing. We don't have the means to test everybody. We don't yet have an effective way to do contact tracing. We can actually follow infection and see where the exposures are, which have shown to be extremely effective, especially with a place like South Korea. I mean, they controlled it very well. That's what they did. They had universal testing and contact tracing, and they're able to control it. And I think since that's not really a possibility in the near future for us, based on the things I'm seeing in different communities, we need to be aware that it's a big risk to go out. And so we really should be limiting our trips out for, work if we're essential workers, limit our trips out to buy essential items, really question what things are truly essential and which things are just feeling like I want to do that because I'm feeling cooped up. It's hard to make that judgment call, but everyone needs to be really careful. Probably ask themselves twice, is this trip out worth it?
Right.
So the first thing is really take that stay-at-home order seriously and understand it's not there to limit us, but to actually protect us. That's the first thing. The second thing I would say is mask, wear a mask. It's important to those around you. So when you are wearing a mask, you're reducing the exposure to others. And when they wear a mask, they're reducing that exposure to you. So 2 people wearing masks is the best for both people. Just keep in mind that we are a community, that our decisions do affect others around us. So while we are free to come and go and do as we would like, those decisions do have real world consequences. So we need to weigh those out. And I know I see a lot of people who are frustrated, which I get. They don't know when it's going to end. It will end. They just wish they knew when and how. So it does get where people feel antsy, cooped up. They feel like they don't have a lot of things they can do, and they're frustrated because they get to get out to work, go to businesses, and it is frustrating. But if we look at the rates of new infections, they're still high. We're still seeing way too many new cases every day. We're not seeing enough of a decline. We talk about flattening the curve, and everyone's saying we're flattening the curve. That's only an indication if our hospitals can handle the infections. It does not mean it's safe to go out. It just means we're at a point that if we will not be overwhelmed if we have to take care of cases of COVID. Right. And I think that's a misconception I see a lot. And then just remember that even when they start relaxing the stay-at-home and opening up more services, that it's a very slow progress, and it does not mean it's safe. It just means that we are safe to start exploring a little bit of a move forward.
And I think one of the things that we talk about also is that I think as a society, we do a disservice, maybe from the medical standpoint. I think I've heard someone say, and I agree with this, we do a disservice to only talk about the death rate. That's terrible in and of itself, but also this virus is rough, and people who get it and endure it, it is not pleasant. I mean, you have the asymptomatic people, but people who get it and survive, thankfully, they said that it's one of the worst things they've gone through, and they're also finding that there are very lasting effects on the organs of the body. So it's not, sometimes people just point to that death rate and say, oh, look, this is crazy, it's not affecting that many people, and look at the survival, and even the death rate, when they say, oh, it's like the flu, it's far more deadly than the flu. And this isn't to be fearful and to make people terrified, but also to take it seriously too. This is a serious thing. I've never seen anything like this in my lifetime, and I think sometimes we focus on these numbers, and that's important, but also to recognize that this virus is no joke, and it's not just about mortality, but also the suffering that comes from it and the lasting effects that can come from it. And we don't always talk about that enough. And about the masks, I saw a study today that said if 80% of Americans wore masks, we would see, like all the time, out and among people, we would see a serious decline of cases. So that seems like such a simple thing that would make a really huge impact.
Right.
And as you were speaking, one thing that maybe I mentioned it earlier, but just there are so many epidemics we've faced, even in our lifetime, emerging diseases, but in the vast majority of cases, those are limited to the individual person. That when we see, like, we saw the HIV epidemic come about, largely you could avoid exposure if you knew how to avoid that. And the disease affected yourself, the person who contracted the disease. But we're seeing now that the effects of this pandemic of COVID is that even if you're being as careful as you can, you are still affected by those around you. And that spread is from other people, not just from yourself. And so, again, coming back to that idea of our actions affect others, and we have to think about our communities at large, I think that's an important thing to remember.
Yeah, I agree with both of those points. And I actually was talking to my wife this morning, and she had pneumonia last summer, which is, not fun.
No.
And it took, to actually get over the pneumonia, I think was like 2 weeks, but it was probably 2 to 3 months before she was 100% again. And from the people, I've had people in my extended family who have contracted COVID. They work in hospitals, and even some of my second cousins who are young and got it. Like it is not something that you just 3 days later you're back up and at everything. I mean, they're still recovering weeks later. So it's that, I think that point sometimes people miss, like, oh yeah, not too many people are dying, which too many, 86,000 in the country or whatever. But that's a number it's hard to comprehend, especially when, like here in Annville, I don't think anybody has died from it. In Lebanon County, there have been 12 or 14 cases people who have died from it. So it seems like, oh, it's not maybe that big of a deal, but like you're saying that, the recovery for those who get it and survive is also not trivial.
It's not, and people worry about missing work, which is a concern. But some of the cases I've heard of, they're out of work for 5-6 weeks with COVID. So that is people who are really concerned about the economy. That's an economic risk as well. I mean, I'm a person who thinks more first and foremost about physical and mental health, while recognizing that economic impacts are important. But if people are going to focus just on the economic impact, 5-6 weeks of being sick and missing out, and we live in a country where we deal with medical bills and expenses that other countries don't have. Those are some real economic risks.
And again, like even mentioning numbers, it shows us statistics can be deceptive. It's really hard to comprehend sometimes. Sometimes it seems low, but we're seeing, like, depending on the state, and here in Pennsylvania it fluctuates, but if you look at the number of cases that were diagnosed, the number of deaths, we're looking at 5-6% sometimes. And if you look at a community like Lebanon County, we're talking above 5,000 people that ever were to contract it. So even if it's spread through to everyone, we all got it, and most of us got to recover. That's 5,000 people in a short period of time in our community who would die. And then when it's your loved one, that's 100%. Like that, it doesn't matter how many other people are there. If your loved one is the one who gets it and dies, that's 100% of the people in your family who got it, who died. And sometimes we forget that those statistics are people. It's easy to gloss over it and say, well, so many don't get it or so many don't die. But everyone that dies is a person to somebody else that matters. And it's putting statistics and attaching it to real people is a tough leap sometimes.
Right. Yeah, that's a good point. I mean, I know there's been a lot of discussion too about the population that gets it, or that at least that tend to die from it tend to be older people. A lot of the cases in Pennsylvania seem to have been at nursing homes or long-term care facilities. And I mean, the implication to me behind those discussions is always like, so what, those people are going to die anyway. But in truth, we're all going to die anyway. It seems like if there's things we can do to help people survive longer, we should be doing those things.
I would agree.
I agree. I mean, their life has value with whether they're 90 or 20,
Yeah, there's no other age group that would say that about.
No.
We'd be so callous. Like if it was affecting, 20-year-olds in college and young workers, we wouldn't be saying, well, no big deal. Like we'd be assigning that kind of a value to human life. And so
Hmm.
it, you're still seeing a lot of cases outside the nursing home. They're just in a situation where it's tough to treat it once you get in those situations. And so
Right.
we need to just step back and see that it's, in fact, if it's 60 or 70% nursing home deaths, still 30% in our community that's
Right.
happening. So it's
Right.
again, not zero.
Right. And I think the other thing is, the people who are in those nursing homes are not often people who are out traveling in the community. So it is reaching them some other way from people who are traveling out in the community.
Yeah.
So,
Right, especially considering that I believe most of them can't have visitors right now.
right.
So it could be asymptomatic staff. But I actually, I have several friends who work in those kinds of facilities, and I can tell you they're carrying a real heavy burden every single day. The mental health toll on them, tears, fears, worries, because they're worried about getting it themselves and taking it to their families. They're also so concerned about possibly taking it to their residents. When people work at these facilities, they get to know these people, and truly care about them. And I've spoken to a couple of nurses that have just said it would devastate them if anything happened to any of their residents. Every day their frustration with seeing people not take things seriously is adding to their already low morale at work, because they are scared. They don't want their residents catching this, and they know that the possibility could come from staff being asymptomatic, and for them not to catch it, they need everyone else in the community to be careful so that it doesn't spread.
Right. Yeah, I think that makes sense. And, you've mentioned a couple of times about the mental health impact of this. And that was one of the questions I had, is if either of you or both of you have noticed an increase in, mental health issues, either just in terms of number or even intensity.
Yes, I have for sure. I mean, anecdotally, I have all kinds of stories. I do want to add and point out that I've actually also heard from a lot of people who are enjoying this downtime and feel like they can't say that. They said, so many people are having a hard time. I feel like I can't say that I'm enjoying not rushing around and not running from thing to thing and just sort of having some stillness in my life and with my family. And but they'll admit to me, I don't feel like I can say that. And I think it's okay for people to, I'm very big on whatever you're feeling is okay. And if it's good or if it's uncomfortable, it's there for a reason. So some people are, ironically, they're kind of thriving in this. But that said, a lot of people are struggling. A lot of my more extroverted friends, people I know, are struggling with the lack of contact with other people and being able to go out. A lot of people with anxiety already are struggling with fear and worry about living during a time of a pandemic. Worry about, I've heard from several people who have had panic attacks in a grocery store. They fill their cart, they get their groceries, they're getting ready to pay, and it just builds. And some of them, they just can't even finish the trip. They've had to go to their car, or they get through it and go home and collapse. It's a lot of anxiety. Some people with PTSD, it's gotten kind of stirred up. Those like triggers, and that hypervigilance is nightmares. A lot of people are having crazy dreams. I know I'm having them like every single night. I almost dread going to sleep because the dreams they're a lot of people are reporting this. They're vivid. There's a lot of emotion, and then people wake up and they feel those feelings all day long, and it almost sort of blurs with memories. Like, is this real? Did this happen? Did I dream it? So day and night, this is impacting people. I've heard from healthcare workers. The biggest thing I hear with healthcare workers is, and I want to say, I think people on the front lines, healthcare workers and others, are going to deal with the repercussions of this for years to come, even after this passes. The biggest thing I hear with healthcare workers is there's a real fear they carry every day of possibly taking it home. And that's on top of the work they're doing. It's just a scary sort of back of their mind fear and concern. Anecdotally, another thing I've actually heard from some children of healthcare workers that have, like, some teenagers that have reached out to me and just said, like, my mom, my dad, they're really struggling. What can I do to help them? I've noticed sometimes they cry, or sometimes they're wiping everything down in the house, and sometimes they're irritable. So kids, teens, they see this, they know, and the ones I'm hearing from, they're pretty impressive kids. They're compassionate, they're empathetic, and they want to know what they can do to help their mom or dad. So I don't think people always think about that kind of domino effect, like the emotional impact it's having, not only on patients, but on those caring for them, and then their families, and then the community. There's just a real ripple effect of emotional impact with this. And yeah, I am seeing an uptick.
I work primarily at the hospital with psychiatric patients, and so sometimes it's hard to gauge what the impact is. I am seeing people come in a little more nervous and frustrated about that on top of what's going on in their lives. I can speak to staff and employees of the hospital just living, like, it's like hair trigger panic attack kind of thing. Like, we had one staff member test positive, and the entire facility just, it was, the level of worry and anxiety stepped up so many levels. Right. All of a sudden, everyone's worried about all the kids that were there, all the patients, every staff member they talked to. It's right at the edge bubbling. I know for me personally, I just, by the time the end of the day comes, I'm emotionally exhausted. Like, it's unlike anything I've experienced before. I just can't function. It's like, I gotta go to bed and just, I'm out. It's a lot different than my working days before this happened.
Yeah. All right. And I think that was really I think we've covered all the questions I had. I had some other individual ones, but I think we've talked about those in this process. So I will leave it open for you guys if there's anything else you wanted to share, or any final thoughts, and then we'll wrap it up.
Well, I mean, do you have something? Sorry.
Yeah, I mean,
mine will be a hopeful note.
Okay. That's not that bad. Just a lot of us are doing more interactions now virtually, whether it be through video conferencing, or a lot of us are on Facebook or other social media talking back and forth. And the frustration is palpable. We can see so many people who are frustrated for good reasons. I mean, I don't see anybody who's expressing irrational frustration. And I just see a lot of people are sort of living at the edge of their patients. And we should all remember that we're all kind of in that same situation, that every one of us is at the edge of what we can tolerate for different reasons. And just remind ourselves that we may have different viewpoints on how to get to the end of this, on how to approach this, but know that everyone has a vested interest in protecting themselves, their livelihood. No one's looking to cause big problems. Just be aware that those around us really do want to get through this safely, and we could do a lot to sort of soften our responses to others as we interact. And I think that would go a long way to helping us through this, that when we finally get through this, we can maintain those positive interactions in our communities and not have ruined those along the way because of things we're all worried about.
I think that's really good, is considering where everyone's scared, even those of us who have different thoughts on this and different opinions and different ways we think it should be handled. Everyone's struggling, and when we can get to that place of humanity, that shared humanity, I think there's a lot of healing that comes from that we all need right now. And one of the things I get asked a lot and talk to people a lot about is how to get through this in a way that keeps their mental health as sound as possible. And there are so many things people can do. And I want to recognize that every day can be different. I have days where I feel pretty good. And then I have other days where I am scared and stressed and overwhelmed. I feel for my kids. We have two we have a 20-year-old. She just turned 20. We have a 20-year-old and a 17-year-old. And those are tough ages to be away from all their friends. They're both dating. They haven't seen their dating partners in over 2 months, except, through video. That's been hard. My daughter has been having a fantastic experience at college, and she had to come back, and she was doing very hands-on things in theater and directing and, writing classes, and just the discussion and switching to virtual it's different. There's pros and cons. And my son he's 17. He misses his friends a lot and his activities. So I think it's really hard on teenagers, several adults, that it's kind of hard for everyone in different ways. So some of the things that are helpful are getting exercise every day, going for a walk, getting outside. Um, People are really struggling with routine. I'm struggling with routine. But having some element of routine is nice. Like we've been doing movie nights on Friday nights, and it's just sort of evolved. Saturday nights, we're kind of roasting s'mores we have a fire pit in the backyard. Just sometimes something that gives some definition to the days, like, because every day seems the same a little bit. Like, oh, it's Saturday, we're making s'mores, or oh, it's Friday, let's watch a movie. Um, I tell people to be gentle with themselves. Like some people are trying to demand that they get all these projects done. And for some people, that's making them feel fantastic and it's working, then keep doing it. But if the thought of I should be getting all these things done is adding to your stress, give yourself a whole lot of grace and space to say like, wow, these are crazy times. And if all I've got in me is getting up and, keeping the kids alive and watching Netflix, hey, aces, that's a win. I also think this is going to pass. This is going to be over at some point. And so I literally, I have a list I am keeping of things I want to do when this is over. And every time I'm video chatting with a friend and we say, oh, we should, I grab that paper and I write it down, and it gives me hope and something to look forward to. So one of the biggest things I tell people is just that whatever you're feeling is valid. If it's anger, if it's fear, if it's happiness, if it's peace, if it's, anxiety, it's all there for a reason. Feel it, journal it, work through it, and go on. But we all have to be a little more gentle with, like he said, be gentle with others and also be gentle with ourselves.
Yeah, that's really good advice. And I think, I noticed for myself, especially, social media is both good. It keeps you connected to people. Also sometimes bad because you encounter frustrating people who don't see things exactly the way that you do. And, you always know that you're right and everybody else is wrong. And so, I try to keep that in mind in my interactions, especially there, because, I, I try to think, if I were talking to this person face to face, would I say the things I'm about to type? And then that can sometimes help to reframe it. But it is, I think, that we are all experiencing this same phenomenon. Yes. And so we do have a lot, as human beings, we have a lot of similar things that go on in our minds, fears and anxiety, and the desire to do something meaningful and productive. All those things are part of our experience. And so, as you said, I think, understanding that different people experience that differently and express that differently can help and make things better, both in person and virtually. So
yeah, it's a real challenging thing that as humans, we're hardwired for connection. And so extrovert or introvert, either way, you still need those at least moments of connection. And we're all doing it now virtually, which is better than nothing. I will say, I am so grateful to have the internet and Netflix and video chatting, because it's something like what a time to have this, and what a thing to have. So I'm glad to have that connection. But ironically, right before the pandemic hit, I was actually getting ready to offer all kinds of groups and classes at our office, because I believe so much in the energy of like a group. I think there's a lot of power in getting together as a group of people and being vulnerable and sharing, our struggles together and knowing we're not alone. And I think community is so important. And I was so excited to get that going. And then the pandemic hit. So I'm trying to think of how to do that virtually. I'm working on it, but that community is important. So I tell my kids and I tell people I talk to, it's not the same, I know, but reach out when you can. Check in on your friends. Even just a little text to somebody that just says, hey, I'm just thinking about you today. How are you doing? Or a video chat or phone call. Just little things like that go a long, long way. And if you're feeling kind of lousy, someone else probably is too. And sometimes it just gives a boost to your own spirits to check in on someone else too.
Right. Very good. Yes. All right. Well, I appreciate the time and I appreciate you talking to me.
Yeah, it's nice to chat with you,
Yeah.
and
Happy to do it.
yeah, thanks for asking us.